I want to stay in Texas for a minute because you got to check out this video right here. No, this isn't the Chick-fil-A drive-thru. This is the line at the newest drive-thru testing location in the Dallas area. It opened Wednesday morning, and this site is going to perform 500 tests every single day. And this is why we're having to do this. Look at this graph right here from NBC News that shows the new COVID-19 cases reported in Texas. You don't have to be a graph expert to see that we're seeing a huge spike right here. That's today. Similar story if we move on over to Florida. Again, right? Huge spike July 1st. But you might be thinking, I know what you're thinking, right? Well, we shouldn't be worried, right? Because we're just testing way more. We're testing more people, so there's more cases. Well, tests aren't killing people. And yeah, it's true. We are testing more often. However, check out these two graphs that are showing deaths reported due to COVID-19. Again, huge spikes right where we're at. Like I said, it's not the tests that are killing people, right? It's the virus. And that's why things like bars are closed in these two states, among others as well. Speaking of business closures, I have some pictures I would like to show you guys. Check these out right here. These images coming out from across the country. Right here, Texas. This one is Texas. Check out that sign on the door. That's important. This bar is a Houston establishment, and you can see the sign on the door says closed by the governor. These next three are from New York. You can see what dining outdoors looks like in New York City right now. And this is important because indoor dining was set to start up again in New York City on Friday. And Mayor Bill de Blasio announced on Wednesday, that ain't happening. That's not going to happen. And again, we have another graph that we want to get to you guys because I got to drive that point home. This is so important. Here's another graph. This is what's causing everybody so much concern. This is from the New York Times, and you can see new cases reported nationwide. So how do we fix this? I mean, what do we do, right? It's a question a lot of us are asking. Well, we have our friend here, Dr. Fauci himself, with the latest advice. Check this out.
Anything that furthers the use of masks, whether it's giving out free masks or any other mechanism, I am thoroughly in favor of. I think what we're missing in this is something that we've never faced before, is that a risk for you is not just isolated to you. Because if you get infected, you are part, innocently or inadvertently, of propagating the dynamic process of a pandemic. If we want to end this outbreak, really end it, and then hopefully when a vaccine comes and puts the nail in the coffin, we've got to realize that we are part of the process.
Can we just, for a moment, acknowledge our awesome custom Dr. Fauci bobblehead animation right there? That is pretty awesome. Where else are you going to get that? But hey, look, if you don't want to listen to our Dr. Fauci animation bobblehead, we have two other professionals here to give you some advice. Here, first up, Nurse Honoria. She's got some advice for you guys. We'll let you see what she has to say. She says it much better than I could.
Hello, my name is Honoria Bush. I am a registered nurse here in the Texas Medical Center. Some advice that I have been sharing with my family and friends during this pandemic is to make sure they're washing their hands more frequently. Also, to wear a mask at all times. If you have to be outside, that's at work, grocery store, gas station, please protect yourself so that you can protect others. If you're showing symptoms like shortness of breath, fever, please go get tested. And then quarantine yourself from your family. Make sure that you are avoiding large crowds and practicing social distances of 6 feet. I know with the holidays approaching, people want to get together and barbecue and have a good time celebrating the 4th. But with the things that are going on right now, we have to change our normalcy. If you can do it virtually, please just find ways to be able to protect yourself and your family. Again, we are Houston strong, and we can do this together.
So there you have it. You want to barbecue? I want to barbecue. Everybody wants to barbecue. Cameraman Jeff wants to barbecue. All right? But we got to social distance. We got to wear masks. We have to listen to these professionals. They know what they're talking about. All right. Here's another medical professional for you. Nurse Alice right here. She's also got some advice, and we're going to let that advice ride us into the break. I'll see you guys in a minute.
Hi, friends. It's Nurse Alice, cardiac clinical nurse specialist, family nurse practitioner, and emergency room nurse, here with some tips on how you can stay safe while traveling out of your home during COVID-19. So one of the most important things, the number one thing that you can do outside of staying home as much as possible is wearing a mask. Okay, guys? When we laugh, scream, cry, sing, any of those things, Droplets spray out of our mouth and nasal passageway, and those potentially carrying coronavirus can spread and infect other people. So wearing a mask serves as a barrier. You'll want a mask that covers your nose, your mouth, cups your chin, and securely hangs on the back of your ear, so it has good coverage, like such. If you're looking for an even better mask, you'll want a mask that can mold to your face, which this one does, and has an extra sleeve in here. Some masks have extra sleeves in here where you can put a filter, PM 2.5 filters. So I would say one of my number one tips for people wearing cloth masks is make sure that you get a good quality mask to protect yourself. Something else that's very important is washing our hands with warm soapy water as much as possible. Okay, I can't emphasize this enough because we can't see coronavirus on our hands. And if you're not able to wash your hands, making sure that you have hand sanitizer, this one or this one, right? And using that as often as possible, because we want to keep our hands clean, because very often we're eating, we're touching our nose, we're rubbing our eyes, and those are all entry points for coronavirus, so we need to make sure our hands are clean. Social distance, at least 6 feet from one another. Make sure you avoid touching commonly used surfaces like those public restroom door handles, those common countertops in restaurants. Want to be very, very careful. And then again, get tested. Know your status. Knowing if you're positive or not can make a big difference and hopefully shift your mindset. So you should always be acting with precaution. Knowing your status will be key in helping you to do so. So guys, those are just a few tips that I have. Please be safe, make good choices, and live well, my friends. Bye.